Millions of women experience the impact of sexually transmitted infections every year. STIs don't discriminate. They affect women of all ages, backgrounds, and walks of life. Yet STIs often remain shrouded in silence. Shame, misinformation, and fear can prevent open conversations about sexual health. This silence can have serious consequences, allowing infections to go unnoticed and untreated. Untreated STIs can lead to severe health problems for women. Some STIs can cause pelvic inflammatory disease, which increases the risk of infertility and ectopic pregnancy. Certain STIs can also increase the risk of cervical cancer. Early detection and treatment are crucial in preventing these complications. It's time to break the silence surrounding STIs. This video will provide you with essential information about STI symptoms, causes, and treatments specifically for women. Let's address the elephant in the room, the stigma surrounding STIs. Many women feel a sense of shame or embarrassment associated with STIs. This stigma can prevent them from seeking testing or treatment. It's crucial to remember that STIs are medical conditions, just like any other infection. Having an STI doesn't define you as a person. It's essential to approach this topic with compassion, understanding, and a judgment-free attitude. Open and honest conversations about sexual health are vital for breaking down stigma and promoting well-being. Throughout this video, we encourage you to prioritize your health and well-being above any potential embarrassment. We'll provide you with accurate information and practical advice in a supportive and empowering way. We believe that knowledge is key to making informed decisions about your sexual health. This video will equip you with the information you need to understand the signs and symptoms of common STIs in women. We'll discuss the various causes and modes of transmission, empowering you to assess your risk factors. Early detection is often the key to successful treatment and preventing long-term health complications. We'll explain the different types of STI tests available and guide you on when and how to get tested. We'll also delve into the range of treatment options available, emphasizing the importance of seeking professional medical advice. Remember, you're not alone in this journey. Understanding the symptoms of STIs in women is crucial for early detection and treatment. While some STIs may present noticeable symptoms, others can be more subtle or even completely silent. It's important to remember that every woman's body is different and symptoms can vary greatly. One of the most common signs of an STI is unusual vaginal discharge. Pay attention to any changes in the color, consistency, or odor of your discharge. For example, a thick white discharge accompanied by itching could indicate a yeast infection, while a fishy odor might suggest bacterial vaginosis. Other common symptoms include itching or irritation in the vaginal area, pain or discomfort during sex, and burning sensations during urination. You may also notice sores, bumps, or blisters around your genitals. If you experience any of these symptoms, it's important to consult a healthcare professional for proper diagnosis and treatment. Vaginal discharge is a natural part of a woman's reproductive health. It helps to keep the vagina clean and moist, protecting it from infection. However, changes in the amount, color, consistency, or odor of your discharge can indicate an underlying issue, including an STI. Normal vaginal discharge is typically clear or milky white and may have a mild odor. The amount and consistency of discharge can vary throughout your menstrual cycle. For example, you may experience heavier discharge around the time of ovulation. Abnormal discharge, on the other hand, can be a sign of an infection. A yellow or green discharge, especially when accompanied by a foul odor, could indicate trichomoniasis, a common STI. A thick, cottage cheese-like discharge is often a sign of a yeast infection, while a grayish-white discharge with a fishy odor may suggest bacterial vaginosis. Pain is your body's way of telling you that something is wrong. When it comes to STIs, pain can manifest in various ways. One common symptom is pain or discomfort during sex, also known as dyspareunia. This pain may be felt in the vagina, pelvis, or lower abdomen. Another painful symptom is pain in the pelvic region, which can be a sign of pelvic inflammatory disease, PID. PID is a serious complication of untreated STIs, particularly chlamydia and gonorrhea. It occurs when an infection spreads from the vagina to the uterus, fallopian tubes, or ovaries. Painful urination is another symptom that should never be ignored. It can be a sign of a urinary tract infection, UTI, which can sometimes be associated with STIs. If you experience burning or pain when you urinate, it's important to see a doctor to determine the underlying cause. One of the most challenging aspects of STIs is that they can often be asymptomatic, meaning you may not experience any noticeable symptoms at all. This is particularly true for certain STIs like chlamydia, gonorrhea, and HPV. While it may seem counterintuitive, asymptomatic STIs can be just as harmful as those that cause symptoms. If left untreated, they can lead to serious long-term health problems, including infertility, ectopic pregnancy, and cervical cancer. That's why regular STI testing is so important, even if you feel perfectly healthy. Talk to your doctor about your sexual history and risk factors to determine how often you should be tested. Remember, early detection is key to preventing complications and protecting your reproductive health. Now that we've discussed the common symptoms of STIs in women, let's delve into how these infections are transmitted. Understanding the causes and modes of transmission is crucial for protecting yourself and your partner. STIs are spread through the exchange of bodily fluids, including semen, vaginal fluids, and blood. These fluids can carry the bacteria, viruses, or parasites that cause STIs. Transmission typically occurs during sexual contact, but there are other possible routes of infection as well. It's important to note that STIs cannot be spread through casual contact, such as hugging, kissing, sharing utensils, or using the same toilet seat. Sexual contact is the most common mode of STI transmission. This includes vaginal intercourse, anal intercourse, and oral sex. Any type of sexual activity that involves the exchange of bodily fluids can potentially transmit an STI. The risk of transmission is higher if you have multiple sexual partners or engage in unprotected sex. Using condoms correctly and consistently can significantly reduce your risk of contracting or transmitting an STI. However, it's important to remember that condoms do not provide 100% protection, as STIs can also be spread through skin-to-skin contact. It's essential to have open and honest conversations with your partner about sexual health and STI testing. Knowing your partner's sexual history and getting tested together can help to minimize risks and promote a safe and healthy sexual relationship. There are many myths and misconceptions surrounding STIs, and it's important to separate fact from fiction. One common myth is that you can tell if someone has an STI just by looking at them. This is simply not true, as many STIs have no visible symptoms. Another myth is that STIs can be spread through swimming pools, hot tubs, or toilet seats. Again, this is false. STIs cannot survive outside of the human body for very long, and they cannot be transmitted through casual contact. It's also important to remember that having an STI in the past does not make you immune to getting it again. Some STIs, like herpes and HPV, can remain dormant in the body and reactivate later on. Others, like chlamydia and gonorrhea, can be reinfected if you come into contact with the bacteria again. Early detection is paramount when it comes to managing STIs effectively. In many cases, STIs don't present noticeable symptoms, especially in the initial stages. This asymptomatic nature can be misleading, as it might create a false sense of security, leading individuals to unknowingly transmit the infection. Timely testing acts as a crucial intervention point. It allows healthcare professionals to identify the presence of an infection even before symptoms manifest. This early identification opens up a window of opportunity for prompt treatment, preventing the infection from progressing to a more advanced stage where it might cause irreversible damage. Moreover, early detection plays a vital role in curbing the spread of STIs. When an individual is aware of their status, they can take necessary precautions to protect their partners. We understand that the prospect of getting tested for STIs can be daunting for some women. The fear of judgment, breach of privacy, or receiving a positive diagnosis can act as deterrents. However, it's crucial to remember that healthcare providers are bound by strict confidentiality guidelines. Your medical information, including your STI test results, is kept confidential and is only shared with individuals directly involved in your care. Furthermore, reputable clinics and healthcare providers approach STI testing with sensitivity and respect, creating a safe and non-judgmental environment for patients. If you're feeling anxious or apprehensive about getting tested, don't hesitate to reach out to your healthcare provider or a trusted counselor. They can provide you with accurate information, address your concerns, and offer emotional support throughout the process. Getting tested for STIs is typically straightforward and painless. Tests depend on the infections being screened for and your risk factors. Common tests include urine tests for chlamydia and gonorrhea, blood tests for HIV, syphilis, and herpes, swab tests for bacteria, viruses, or parasites. Your provider will recommend tests based on your history and symptoms. Don't hesitate to ask your doctor any questions. Section 4. Taking control of your health empowerment through testing. Getting tested for STIs is not just about receiving a diagnosis. It's about taking control of your sexual health and overall well-being. It's about equipping yourself with the knowledge and information you need to make informed decisions about your body and your relationships. Remember, knowledge is power. By understanding your STI status, you can access timely treatment, prevent potential complications, and protect your future fertility. You can also engage in open and honest conversations with your partner, fostering trust and mutual respect. In an era where information is readily available, there's no shame in prioritizing your sexual health. Embrace testing as a proactive measure, a testament to your commitment to your well-being. Section 1. Chlamydia and Gonorrhea. Bacterial infections, effective treatments. Chlamydia and gonorrhea are two of the most common bacterial STIs, particularly among young adults. These infections often have subtle or no symptoms in the early stages, making regular testing crucial for detection. When symptoms do occur, they can include painful urination, unusual discharge, and pelvic pain. Fortunately, both chlamydia and gonorrhea are curable with antibiotics. Typically, a course of oral antibiotics is prescribed to eliminate the infection. It's vital to complete the entire course of antibiotics as directed by your doctor, even if your symptoms improve before finishing the medication. This helps ensure that the infection is fully eradicated, preventing recurrence or complications. Early treatment is essential to avoid potential long-term health issues. Genital herpes, caused by the herpes simplex virus, HSV, is a common viral STI. While there is no cure, antiviral medications can manage outbreaks and reduce symptoms. These medications suppress the virus, preventing sores. Symptoms vary greatly. Some have frequent outbreaks, others mild or none. Common symptoms include painful blisters, itching, and burning. Managing herpes involves medication, good hygiene, and avoiding contact during outbreaks. Open conversations with your partner are crucial. Condoms and medication reduce transmission risk. Section 3. HPV, prevention, detection, and treatment options. Human papillomavirus, or HPV, is a group of viruses, many of which are sexually transmitted. HPV is incredibly common, and most sexually active individuals will contract at least one type of HPV. Fortunately, we now have highly effective vaccines that can protect against the most common cancer-causing types of HPV. Regular cervical cancer screenings, such as Pap tests and HPV tests, are crucial for detecting any abnormalities. Section 4. HIV/AIDS, navigating a chronic condition. HIV attacks the body's immune system, making it difficult to fight off infections. Untreated, HIV can progress to AIDS, severely weakening the immune system. While there is no cure, treatment has transformed HIV into a manageable condition. Antiretroviral therapy, or AOT, involves taking daily medications to suppress the virus. RT helps individuals live long, healthy lives. Early diagnosis and treatment are crucial. Regular testing is essential for those at risk. With proper care and a healthy lifestyle, people with HIV can lead fulfilling lives. Section 5, Syphilis. Early detection is key for a cure. Syphilis is a bacterial infection that can have serious health consequences if left untreated. The good news is that syphilis is curable in its early stages with antibiotics. The challenge lies in its ability to mimic other conditions, making it easily misdiagnosed. Syphilis progresses through different stages, each with its own set of symptoms. Protecting yourself. Proactive steps for STI prevention. When it comes to STIs, prevention is always better than cure. While some STIs are curable, others can have lasting health implications. The good news is that many effective prevention strategies are within your control. By adopting these practices, you can significantly reduce your risk of contracting or transmitting STIs. Condoms remain one of the most effective methods for preventing STIs. When used correctly and consistently, condoms act as a barrier, preventing the exchange of bodily fluids during sexual activity. Make sure to use a new condom for each sexual encounter and store them properly to maintain their effectiveness. Open communication, the foundation of sexual health. Open and honest communication with your partner is paramount for maintaining sexual health. Talking about STIs shouldn't be taboo. It's an essential aspect of a responsible and caring relationship. Discuss your sexual histories, get tested together, and establish ground rules that prioritize both of your well-being. Before engaging in sexual activity with a new partner, have an open and honest conversation about STIs and testing. Share your own STI status and inquire about theirs. Encourage each other to get tested together to ensure you're both starting the relationship with a clean bill of health. Remember, conversations about sexual health should be ongoing throughout a relationship, not just a one-time discussion. As you grow closer and your relationship evolves, continue to communicate openly about any concerns, questions, or changes in your sexual health. Recognizing the red flags. Don't ignore the signs. Navigating the complexities of sexual health can feel overwhelming, especially when trying to determine if professional medical attention is necessary. While this video provides valuable information, it's not a substitute for personalized medical advice. If you experience any unusual symptoms or have concerns about your sexual health, it's crucial to consult a healthcare professional. Remember, early detection and treatment are paramount when it comes to STIs. Don't ignore persistent or worrisome symptoms, hoping they'll resolve on their own. Delaying medical attention can lead to complications, some of which might have long-term health implications. Pay close attention to your body's signals. If you experience unusual vaginal discharge, pain during sex or urination, sores or blisters in the genital area, or any other concerning symptoms, it's best to err on the side of caution and seek medical advice. Prioritizing your health. Seeking professional care. We understand that discussing sensitive health matters can feel daunting, but remember, healthcare providers are there to support you. They are bound by confidentiality guidelines, ensuring your privacy and providing a safe, non-judgmental space to address your concerns. Schedule an appointment with your doctor or visit a sexual health clinic if you suspect you may have been exposed to an STI, even if you don't have any symptoms. Early testing and treatment are essential for preventing complications and protecting your long-term health. Don't let fear or embarrassment prevent you from seeking the care you need. Your health is a priority, and taking proactive steps to address any concerns is a sign of strength and self-care. Taking charge of your sexual health empowerment through knowledge. We've explored the intricate landscape of STIs in women. From understanding symptoms to navigating testing and treatment, we've aimed to equip you with the knowledge to take charge of your sexual health. Remember, knowledge is power. Your health, your journey. Seek support and thrive. Your sexual health is an integral part of your overall well-being, and it's a journey that deserves care, attention, and respect. Remember, you're not alone in this journey. Millions of women worldwide face similar experiences and challenges, and there's a wealth of support available to guide you. From trusted healthcare providers and reputable sexual health clinics to online resources and support groups, you'll find a community ready to provide accurate information, compassionate care, and a listening ear. Don't hesitate to reach out for support when you need it. As we conclude this video, we encourage you to embrace the knowledge you've gained, prioritize your sexual health, and approach this aspect of your life with confidence and self-compassion. Remember, you are your own best advocate, and taking care of your sexual well-being is a powerful act of self-love.